Guys, welcome back to Medical Coding with Blue. Today is Q&A Tuesday. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Every week I take all of the questions that have been submitted from viewer comments, through emails, and from Instagram, and I roll it all into one episode, and here we are. So if you would like to have your questions submitted for a future episode, please comment below or send me an email. I will include my email address in the description box below. And thank you to everybody who submitted their questions. Let's get started. First question, what if you want to do this in the dental field? I used to be a dental assistant and would like to do coding, but in a dental atmosphere. You absolutely could do that if you wanted to. The thing about you being a dental assistant is that you're going to have lots of transferable skills. You are obviously going to have a very good working knowledge of the anatomy and the procedures that are performed in the dental atmosphere. So the great thing about that is with you bringing on your skills as a certified medical coder, you're going to really be able to spot where the provider can get additional credit. A lot of times in dental offices, sometimes they don't have a certified medical coder on staff. A lot of times they just have like the secretaries or maybe an office manager that takes care of the coding because it's all generally the same, right? But if you have a certified medical coder on staff, you're going to be able to see where there's potential for additional revenue. When you have more complicated patients, like patients that are diabetic and things like that, that is going to play a big part in, okay, there's going to be an increased level of care because if a patient is a diabetic, there's lots of things that can happen, right? So having that knowledge and being trained as a medical coder is really going to help you. But absolutely, if you want to get a credential and you want to go into coding for dental offices, by all means, go for it. I think you have a very good resume already, right? Because you have been a dental assistant and now you are a medical coder. So lots of really good things that you can bring to that practice. All right, so next question. Is medical coding in high demand? You can look at any search engine for jobs and see that there is a demand. I will say this. Sometimes these job listings are not always listed under medical coder or medical biller and coder. It will be listed under different names like health information tech, health information clerk, medical records tech. Sometimes they are listed under like prior authorizations as well. So there's lots of different names that medical coders go under. You just have to really know and understand what you're looking at in order to find those jobs. So I do have a playlist where I talk about the breakdown of these job listings so that you can understand the language. But yes, we are absolutely still in demand because it's healthcare. It's healthcare and there's a lot going on. Obviously, with the pandemic right now, we are in demand as well because these statistics that are coming out, they have a lot to do with the coding, right? And it's the coding that whenever we do our coding, it is used for not just insurance purposes, but also for statistical reasons as well. So that is something that, you should know. Yes, we are in demand. Next question. Hey Blue, thanks for the wonderful information. I was a medical coder at an acute care specialty hospital for 8 years, no certification, but have an associate degree in HIT, Health Information Technology. Right now, I want to earn a certification and get back into coding. I have coded in ICD-10-CM and ICD-10, ICD-10-CM and ICD-9. Sorry. I got training in ICD-10, but not PCS. Please advise which place is best for ICD-10 PCS training. I want to sit for a CCA and a CCS. All right, so here's the thing. Just so that we can clarify, a CCA is a Certified Coding Associate, and that is a credential offered with the American Health Information Management Association. This credential says that this is considered an entry-level credential, all right? This is a very prestigious credential anyway. A lot of people say, well, people don't ask for it. Well, I have done job listing reviews, and there's plenty of job listings for a CCA. Okay, I'm just going to say that first. But I will say this, you have a degree. So this is going to put you into an elevated level. If I were you, I would definitely go after the CCS, and I would not start with the CCA. I would start with the CCS because you already have that background already. You have your degree. The only thing, obviously, that you need to learn is the PCS. AHIMA does offer an online course, and I will leave the link for that online course. Oh, don't sneeze. I've been wanting to sneeze all day, guys. Oh, it just came out of nowhere. All right. AHIMA does offer an online course for PCS. I will leave the link in the description box below. That way you guys can check it out. That is the only one that I can recommend truly because it's with the association themselves. There are other places, but they're going to make you go through the entire program. And obviously you don't need to because you have a degree already. Sometimes facilities are okay with people who just have their degree and they don't need a credential. And sometimes they want you to have a credential because it just depends on what your experience is. Obviously, the viewer wants to get into the inpatient side of the house coding because that's the only reason that you are going to want to learn ICD-10 PCS. It is not necessary to learn ICD-10 PCS if you are only wanting to work in the outpatient side. The outpatient side is going to include like the emergency room, the outpatient clinic visits, and things like that. Acute care, urgent care places, that's all outpatient. Inpatient is when they are physically staying in the hospital. And again, you're not going to be using the CPT, you'll be using the PCS. But the only place I can recommend is the association themselves. That way you're not having to go through all of the process of doing that. But you can study on your own. Given that you've had the degree, you do meet the educational requirements currently to sit for the CCS. I do have a video that breaks down the independent study. It is a template, okay, guys? This is what I learned in the order that I learned it, and this is going off of memory because I became a coder over 10 years ago. The thing is, I have all of the books listed that you need. And if you want to learn this on your own, you absolutely can. For somebody that already has a degree and they want to study PCS on their own, it's really something that I think you can pick up through a book. You may have to have somebody explain things to you. So that is a possibility. There are tutors out there. I am one of them. I am a tutor. But I will say that my strengths lie in the outpatient side. I do know enough on the inpatient side to get through, but my strength is with the outpatient coding. So I will just say that up front. I do leave my rates in the description box below if you are looking for a tutor, medical coding tutor. But yes, so you would be able to study on your own and sit for the exam whenever you are ready for the CCS. But that would be what I would recommend for you, given that you've already had a degree. Okay, so the CCS, I will also say this, is the gold standard of medical coding credentials. All right, this one credential says that you can code in both the inpatient and outpatient settings. So that's my bit on that. Next one. What is your advice for studying the guidelines? Read, read, read. The thing with adult education and teaching adults and an adult's learning is repetition. That is the whole thing. When it comes to learning the guidelines or studying the guidelines, reading is a huge part of it. I also recommend that you read it once a week. Read the entire guidelines once a week. If you are looking in the ICD-10 CM book, it is 31 pages, 32 pages, something like that, 33 pages maybe. I think it's 33 pages. But read it once a week. You can break it down if you need to. You can break it down into 10 pages per day. But as long as you're doing it once a week. So that way you can get familiar with it. The thing with reading the guidelines once a week is that you will become faster at reading. That's a good byproduct to have because when you are going in to sit for your certification exam, you're going to have to get through at a very good clip in order to make the time, because you don't want to run out of time when you're taking your exam. There's a lot to read in that exam, guys. It doesn't matter which certification exam that you're taking, all right? So reading the guidelines once per week is only going to benefit you. Is it a lot of heavy lifting? Yes. Can you record yourself and play it back so that you can listen to it later? I recommend that, because you're just listening to yourself then. Okay, so that is something to do. I mean, that is something that you can, try if you think it will help you. But read, guys. That is what I totally recommend. All right, next question. Based on what you have heard or seen, would you say that medical coding is a less stressful job than nursing? All right, so I'm going to do a video on this very topic, but I will say this. When it comes to the stress level of medical coding, it depends on the individual. Some people don't think that reading is stressful. I don't think reading is stressful. I can do it all day. However, there's some people that just don't like to read. They don't like to read. They don't like to study. If that's you, then this is not a field for you. And I'm just being honest. I am very blunt, and that surprises a lot of people. But I'm just telling you guys, because I don't want you to waste your money when you don't need to, all right? If you're going to pursue this career in medical coding, medical billing and coding, you have to know that you've got to be detailed, and you've got to like to read, and you have to be a very good communicator. So those are the things that, just very briefly, that you have to be aware of. When it comes to nursing, nursing, you're dealing with patients, and you're having to physically move them and touch them and maneuver them and doing all of these things. You have to deal with the patients. And, I follow quite a bit of doctors on on Instagram and YouTube, and they talk about all the things that nurses go through. Nurses go through a lot, medical coders, on the other hand, we have to do a lot of reading. We have to do a lot of studying, because we have to know what doctors know, while never having gone to medical school. And the ones that yell at us is the doctors or the other staff, the other ancillary staff. So, I mean, we occasionally get yelled at because no provider wants to be told that they're not doing something right. That's when your good communication comes into play, all right? So you know how to diffuse those situations. But it's not stressful to me, but that's my opinion. Some nurses have said, I don't get this. I can't understand it. I tried it and I just didn't like it because I didn't understand. It depends who's teaching you too. So that is another thing as well. If you are a nurse and you want to make the transition, a lot of employers get very happy when they see a nurse turned medical coder, because they have somebody who has a built-in relationship already with a provider, because a provider will gravitate more towards a nurse quicker than he will a medical coder. So that is just something to think about and to know. But like I said, it's going to depend on the individual. I can tell you guys, but I'm not going to lie to you. There are going to be times when medical coding does get stressful. I mean, you have to think about like your production, and you got to think about accuracy. And so there's a lot of those things. But it's like any other position. You have to be willing to take the good with the bad. So that's my answer on that one. Next question. Are medical coders the same thing as medical records technician? Thank you. All right. That is another alternative name for medical coders, medical records technician. Sometimes a medical records technician is just a person who works with the records, and sometimes facilities will refer to a medical records technician as a medical coder, right? That is, it's an umbrella term for some facilities. So, next question. Are there any advantages to taking an HIT, Health Information Technician, or HIM, Health Information Management program? What are the advantages? If you want to be a manager, supervisor, a lead coder, an educator, or an auditor, or like I said, somebody on the executive floor, that's when you want to get your degree. I'd say this a lot because a lot of times these schools are not truly explaining what actually happens with somebody who has an RHIT, which is the Registered Health Information Technician. That is the associate's degree offered with the American Health Information Management Association. Then there's a registered health information administrator, and that is the bachelor's degree, and that is also offered with the American Health Information Management Association. Those are the people that are basically your management side. Those are the ones that are going to be running the show. And a lot of people are kind of like shocked, like, really? But when you're trying to apply for a job and the employer sees that you have a degree, they're going to expect that you want to be in a managerial position, or they're going to try to put you in there because that is what those programs do. They train you to be a manager, to be a supervisor, to be a leader. That is what they train you to do. And oftentimes, it depends on what your position is. The pay scale is not that much different from somebody who has a degree versus somebody who has just a certification. So that is something to think about. Even me, I have seen where I have made just the same as somebody with an RHIT. And sometimes I've made a little bit more. Sometimes the RHIT makes a little bit more. It just depends on where you are and what you're doing. So that is something to think about. I don't have student loan debt, period. And, you know, people who have degrees are like, well, really? I didn't know. Well, that is the thing with medical coding. It's sort of weird, but the credentials hold just as much weight as somebody with a degree. The reason that you should have a degree is if you want to get into that managerial side of the house. So that's just my advice on that one. Next question. Hi, Blue. Can you please explain what is the Certified Coding Specialist Physician-Based? And is it inpatient or outpatient or both? Okay, so the Certified Coding Specialist Physician-Based, the CCSP, is a credential offered with the American Health Information Management Association. That is all outpatient coding, all right? CCSP, the physician-based, is letting you know that this is all outpatient side. The CCS by itself, right? That is both inpatient and outpatient. But adding that P, that physician-based, is letting you guys know that this is all outpatient coding. Okay, so there is no inpatient for the CCSP. All right. Next question. Do you have to take an anatomy class to get into this field? You do have to know your anatomy. As far as like taking a class, some employers will ask you to have had a class already. Some will ask you, do you know your anatomy? So it just depends on where you are and where you're applying. It does help. You do need it because this is going to be like reading a different language. And if you don't know your anatomy, physiology, and medical terminology, you are going to be sinking very fast. You have to know this stuff. This is not something that you can get by without knowing it. There's many words that mean the same thing, and there's many words that mean the opposite of different conditions. So you have to be able to know these things. So that is my advice. And if you have taken an anatomy class, I would strongly recommend that you put that on your resume. And the last question, do you do tutoring? What days? How much? Thank you. All right, so I will leave my rates in the description box below, but I do offer tutoring. I do outpatient medical coding, and I've done it for over 10 years. Obviously, if you've been watching my channel, you know I love it. So I'm very versed in a lot of clinics. There's pretty much nothing you can ask me about the outpatient side that I don't know or I don't know how to find the answer to. But I am available for tutoring after 5:30 p.m. During the weekdays, and on the weekends I'm available all day. So again, my rates are in the description box below. So if you're interested in that, please check that out. I will also leave my email address so that way you guys can contact me to set that up if you are interested in that. I also offer professional coaching, and professional coaching includes everything when it comes to like your resume, reviews. I do those. Professional coaching, like when you are talking with providers and how you should carry yourself and things like that. I do all of that as well. And again, those rates are in the description box below. So I am going to go ahead and wrap this one up. Thank you guys so much for joining me, and keep those questions coming, and I will see y'all on the next episode. Bye.